So before I get started, I just wanted to remind you once again that whatever we share with you is not meant to be legally binding or prescriptive advice, and that nothing that we share is not available through other public sources. So this is basically just a synthesis of different of information that's already available. So yesterday, CMS announced that they're going to publish a proposed rule to the Federal Register. It's likely to be published on the 23rd of May. And the proposed rule basically is designed to provide a reprieve for practices that have not been able to implement or upgrade to the 2014 ONC certified EHR technology, or CEHRT. What this means is that CMS is going to allow practices that have EHR technology from vendors that are not certified for the 2014 edition, or who are midstream because maybe their vendor had one product certified and the other product hasn't been fully certified, that they will allow those providers to attest for meaningful use in 2014 under the 2011 CEHRT certification criteria. So this can have a pretty huge impact for a lot of organizations, because the whole impetus to upgrade to, especially if you're on NextGen or any other EHR technology that was not certified under the 2014 standards, the whole push for upgrading was firstly to be ready for ICD-10, and secondly to be able to attest for meaningful use. However, as it turns out, ICD-10 has been put on hold for at least another year, which puts us at about the October 1st, 2015 timeframe. And then the other impetus, which was being able to attest for meaningful use, with this new proposed rule, what it means is that you do not need to be up and running on your 2014 certified EHR in time to be able to attest for meaningful use in this year. So I'll go over some of the details of what this proposed rule is, but I do want to caveat whatever I'm sharing with you by saying that this is still somewhat speculative, although going off of how CMS has worked with proposed rules in the past, there's a very strong likelihood that this will go through and that this will become effective. So, CMS, of course, is very adamant in insisting that the proposed rule is designed only as a reprieve for those eligible providers who have not been able to upgrade to a 2014 certified edition, and that their intention is to implement the 2014 ONC standards moving forward, which would be fiscal year 2015. So any conversation on meaningful use has to be had in two parallel contexts. The first one is Medicare and the second one is Medicaid, because both programs, although somewhat similar, are also somewhat different. The measures are the same for both programs, however, the timelines differ. For Medicare, providers who have attested in a previous year are required to report for a calendar quarter, and the last quarter for 2014 for reporting actually begins July 1st. For Medicaid, providers, irrespective of where they are in the reporting process, have to report for 90 consecutive days, and those can be any 90 days in the calendar year. So there is a little bit of flexibility. If your practice reports or attests under the Medicare program, you technically by this point, your practice should have been up and ready, up on the 2014 edition of your EHR system. However, if for whatever reason your vendor was not certified under the 2014 criteria, your providers can still go ahead and attest under the 2011 criteria, which means that you will need to start running the reports as of April 1st. As of July 1st, and then be able to submit those reports in the, I believe it's October 1st is the deadline for submitting for 2014 to avoid any penalties. For Medicaid, if your vendor has indicated to you that they will not be able to implement the 2014 certified EHR this year, then it gives you a little bit of a reprieve because you can still attest for meaningful use using your current system. You might remember, if you have joined us for previous sessions, we had talked about how all EHR technology was all the certifications were going to sunset at the end of December 2013. However, this proposed rule would supersede that sunset clause. So there are other impacts as well in terms of which measures to report on. And so I'll spend a little bit of time trying to clarify this for you. If you're using the 2011 certified edition only, then the CMS proposes that all eligible professionals, hospitals, and critical access hospitals must meet the meaningful use objectives and associated measures for stage 1 that were applicable for the 2013 payment year, regardless of their current stage of meaningful use. And for stage 2, CMS had finalized certain changes to the stage 1 objectives and associated measures, and some of those changes were applicable beginning with 2013, while others were supposed to be applicable beginning with 2014. So, if your practice is still on the 2011 certified technology, then you will be required to report on the 2013 measures. If, however, you're using a combination of 2011 and 2014 editions, as is the case with NextGen, where the EHR is 2014 certified, but HQM, I believe, still does not have the 2014 certification, then providers will need to use a combination of the 2011 edition technology as well as the 2014, and they may choose to meet the 2013 stage 1 objective or the 2014 stage 1 objective. So they have a little bit more flexibility in terms of deciding which measures they will report on. Then lastly, if the EHR that you're using is already certified for 2014 in its entirety, then the 2014 standards will need to be reported on. So there's still some ambiguity around who this applies to or who this doesn't apply to. And I think once this proposed rule is actually made public later this week, we should have a much better sense and greater clarity on which vendors and which EHR systems are being impacted by this, and whether CMS will possibly apply the rule across the board, or whether they will continue this sort of stratification of the market where some are on, some technology has been certified under the 2011 standards, other systems have been certified under the 2014 criteria. So there's still some lack of clarity. The other thing that this proposed rule is going to do, and this is not something new, this was something that CMS actually announced back in October of 2013. You might remember that there was some confusion around meaningful use stage 2 and meaningful use stage 3 timelines. The news was announced as meaningful use stage 2 delayed, but in reality, meaningful use 2 had not been delayed. It had simply been extended by a year. Previously, meaningful use 2 was supposed to begin, actually it was supposed to begin in 2013, but they delayed it by a year to 2014, and then it was supposed to continue through 2015, and then January 2016 would have been the beginning of meaningful use stage 3. However, CMS had already announced that they were extending stage 2 by another year, and so stage 3 won't begin until January 2017. And the criteria for stage 3 should be announced sometime this fall. So these are some of the changes that you should be following in the news, just because it could mean that the frantic pace that you might have been working at to upgrade to a 2014 certified EHR system may no longer be necessary, and that you can actually get a little bit of breathing room and implement the system perhaps later than what you might have originally planned. The other thing for you to keep in mind is that 2014 was an exceptional year for meaningful use, and what that means is that this was the only year where, irrespective of whether your providers were attesting for stage 1 or stage 2, they only needed to attest for 90 days or 1 calendar quarter. In 2015, providers will be required to report for the full year unless they've attested to AIU in 2014. If they've already attested to AIU in a year prior to 2014, then you will need to report for them for the full year 2015. So what that means for you from an operational perspective is that you need to make sure that your providers, that your new 2014 certified EHR has been implemented prior to the end of this year, because come January 1st, you will be required to report for the full year, whether it's stage 1 or stage 2, except, as I said, if it's a provider that attested to AIU in 2014. And one aspect of meaningful use that has been getting consistently overlooked is the importance of having a patient portal. So not a lot of practices are aware that being able to implement a patient portal and being able to enroll 50% of your active patient population is a prerequisite to achieving meaningful use, stage 1 or stage 2 moving forward. And this is part of the 2014 criteria that's supposed to be effective this year. It may seem as if enrolling 50% of your patients is no problem, but just based on our experience, the ramp-up period can be anywhere from 1 month to several months. So do allow yourself the room to be able to achieve that 50%. And then if your providers are going to be attesting for meaningful use in 2014, they also need to ensure that 5% of your patients are actively using the portal. And active utilization is defined as the patient being able to schedule an appointment, request a medication refill, and or communicate with the provider using secure messaging. This is something that often gets overlooked. And then the other measure that relates directly to the patient portal is making the visit summary available within 4 days of the encounter. And that is something that needs to be made available electronically on the portal. So if you do find yourself in a situation where you've got some extra time because of the proposed rule, you might want to re-strategize your portal implementation and spend some time educating your patients and sort of putting together a really effective campaign to enroll as many patients as possible. That was all what I wanted to share with you. I think in terms of the Medicare timeline, that still remains unchanged. So the timeline for reporting and attesting has not changed. The only thing that's changed is whether you can use your current EHR system or whether you would need to upgrade and what criteria that you need to report on. So, you know, be mindful of whatever deadlines are imposed by the program that you participate in. So what I'm going to do now is I'm going to unmute everybody so that you have a chance to ask any questions, and I'm happy to facilitate a discussion if that would be helpful. So just give me a minute, and I'm going to go ahead and unmute you all. So, all right, you're all unmuted. So go ahead and ask any questions, or if you have any comments, feel free to participate. No questions? Let me throw one at you. How many of you think you might be impacted by this proposed rule? Anyone? Okay, well, it seems that there aren't any questions, so I will go ahead and wrap this up. If you can think of a question after the fact and you want to shoot us an email, feel free to do so. You can either email Dan Holleran. His email address is dan.holleran, HOLLERAN, @corkhealthcare.com, or you can email me. My name is Tamina, TAMINA, .Vahidi, VAHIDY, @corkhealthcare.com, and we'd be happy to get back to you. Thanks very much for participating. Have a good day. Bye-bye.